Hi, I'm Dr. Kiyanna Williams. I'm a board-certified dermatologist currently practicing in Cleveland, Ohio, and I am looking forward to answering some questions from the Health and Her Hue community. So what are the most common cosmetic dermatologic procedures women are seeking out and why? So by far, this is going to be injections. So we split them up into two main categories. So we have neuromodulators. An example of that would be Botox or Dysport. And then we have fillers. So they do two very different things, right? So neuromodulators, or Botox or Dysport. So what those do is they relax the muscle. So we use those for wrinkles. So wrinkles that we make when we express our face, we help relax the muscle so that we're no longer making those wrinkles and we're no longer creating those etches in the skin. And then the other camp is fillers. So fillers, those are actually replacing volume loss. So some common areas for fillers can be tear trough, so underneath the eyes to help fill in some hollowness, cheeks, lips, those are common areas that we're seeing filler being placed. How should women of color vet a cosmetic dermatologist to ensure they can provide competent care to women of color? So this is one of my favorite topics because it's so important. Now, many procedures, whether that be injections or lasers or peels or whatever it is, are safe in skin of color. Now, there are some that objectively, generally speaking, are not, but many of them are safe. But the one thing that's gonna make the huge difference is who is doing it and if they have experience doing these procedures in patients of color. So that's gonna make or break your experience. It's also gonna minimize your risk of having scarring or hyperpigmentation afterwards. So ask your provider, ask them, do you have experience, working in skin of color? Have you ever used this particular device or procedure in patients of color? Do you have examples? And how do you treat my skin differently than you would someone who's not skin of color? Those are all reasonable questions to ask, and any provider should be happy to answer them for you. What cosmetic procedures should women be extremely particular about finding a dermatologist who is trained to provide care to patients of color? So this is going to be any procedure where you're delivering energy or heat. So this generally falls under the category of lasers, but it can also fall under the category of peels. And the reason that is because people of color, we all have the same number of melanocytes, but people of color, our melanocytes, the cells that make pigment, make more pigment. So whenever energy or heat is delivered to them, they can be either stimulated so they make more, or they can actually be knocked out so that they don't make as much pigment anymore. So what this can mean is it can result in dark spots or light spots, and it can leave permanent scarring. So what you wanna be extremely particular about is any procedure that is involving either removing of some skin, so something like a peel, and then anything that's delivering any energy, such as a laser.